Welcome to the Fits on the Video blog. I'm Tilak Pasala. I'm one of the Interventional Cardiology Fellows at this University of Utah. I have here with me Dr. Saibal Kar. He does not need any introduction. He's from Cedars Sinai. We'll know him very well. Welcome to the Fits on the Video blog.
Thank you. Thank you very much for inviting me and catching me on the way.
That's how we do it. And thank you, Dr. Saibal Kar, for being here. We were very interested about your topic on yesterday. We attended the session with great enthusiasm about the left atrial appendage closure devices. We wanted to get from firsthand what your thoughts are, where the future lies, where we are currently and where the future lies.
So this is actually a very good time to discuss this topic since, as you know, last year ACC we got the FDA approval of the device, and this year by ACC we actually got CMS approval, a national coverage determination. So it makes a big deal. Now patients who undergo the procedure, the physicians as well as the hospitals are going to get paid for it. And therefore there will be an appropriate expansion of this procedure around the country. And it's extremely important for fellows to be involved at this time, especially those who are doing interventional cardiology or structural heart disease like you, to learn this procedure. And learn not only the details of the procedure, but also the knowledge also about the data around it, the clinical trials and evidence. There was a recent presentation, I think yesterday, of the commercial usage after approval, and we presented the first 1,600 patients, and we showed extreme degree of safety under appropriate guidance. So that's actually good. So that means the initial rollout shows safety. Of course, we didn't demonstrate any efficacy benefits because this was just the 30-day outcomes. So I think it's the right time for fellows to be involved now. In this very important topic of atrial fibrillation, since it's an extremely common disease entity.
I have a more technical question for you in the sense that in terms of imaging, I know for interventional fellows, probably we're not paying that much attention on understanding the left atrial appendage anatomy as well as the imaging modalities that are there. Would you like to comment on how much the fellows have to focus on in terms of going to the CT place or radiology or talking to the surgeons, even scrubbing into the surgeries to understand the anatomy very well? Do you have any comments or advice for the fellows?
Yes. So this question, I'll actually make it even expanded to all structural heart disease interventions, right? There's an important need for now interventional cardiologists to understand multimodal imaging, not just angiography. It's primarily echocardiography, transesophageal echocardiography, and CT. Because most of these structural heart disease procedures require echoes or CTs. For example, in TAVR, for mitral you need echoes, and for atrial appendage you need both T as well as maybe CT. So therefore I think the fellows need to get trained. And the training can take place in many ways. For example, while you're in your fellowship program, a lot of us who are very interested in echocardiography can teach you. Also, you can actually go to the specialists, like the echocardiographers or the CT unit, and spend some time learning this. So I think it's critical. I actually tell our fellows that you're not allowed to scrub in unless you've actually read the echoes, seen the echoes, and spent some time. So I think it's very important, especially in the general cardiology fellowship, to really focus on imaging.
One last question for you. I understand that there are a lot more devices that are coming in for left atrial appendage closures. Where do you see the future, and what would be in 5 years' time?
So obviously it took a long time for it to get approval, and rightly so, because the FDA was careful before it gave it approval. And the good news is that we had 5 years of data behind us to support its approval. Now, once it's approved, there'll be a lot of more devices which will be available first in clinical trials. Right. So there'll be a lot of trials. We don't know exactly the designs, whether it'll be device versus medical therapy or device versus device, but there will definitely be more trials in the US. And as you know, that different devices have different advantages. Some will have less thrombogenicity, some will be easier to use, some will be good for shorter appendages. So I think there is a need for more devices, need for simpler devices, and need for safer devices.
Thank you very much. That was very informative.